Green Bay Packers running back Jamaal Williams had a pretty scary moment tonight during Thursday Night Football after taking a direct hit to the head. The medical team came out and had to ultimately place him on his spine board, and he was eventually transferred to a local hospital for more evaluation. Reassuringly, the last update we heard was he was able to move and had sensation in all of his arms and legs. Welcome back, everybody. In this video, I'm going to walk you through the evaluation that goes into these on the field medical emergencies where we're particularly worried about a head injury or a spine injury. There's a lot of really important stuff that goes into these evaluations that the medical team is doing on the field to ultimately ensure that these players stay as safe as possible. We'll walk through the footage of the play where this happened, we'll take a look at the different things the medical team was doing on the field, and I'll kind of guide you through the steps that are going through their heads whenever they're performing these assessments and what they're doing to make sure these athletes stay safe. Go subscribe if you guys like this type of content and want to stay up to date with future videos, and let's get started. Whenever you guys watch this clip, keep in mind that the defensive player is actually also at a pretty decent risk of getting injured in situations like this. One of the primary mechanisms for spinal cord injuries in professional football is whenever players would do a spear tackle. That motion of lowering your head to tackle allows the neck to go into extreme flexion where the chin is tucked down, and then you get an axial load into the top of the head. This is what happens with spear tackling, and it's why this was banned back in the 70s, and afterwards we saw a significant decline in the number of spinal cord injuries. Your neck has a natural curve to it, and that curve is partly what allows it to have some natural shock absorption. But whenever you bend your head forward like you would position yourself for a spear tackle, you remove that natural curvature and you make it more straight, which makes it more susceptible to getting injured. So when they changed all these rules, it was really more so for protecting the defensive players from possible paralysis rather than trying to protect the offensive players. In this case though, with Williams, certainly the head injury I think is going to be top of the list, but let's walk through exactly what happened. As we're playing this, keep an eye on the position of Barnett's head. He's not exactly spear tackling here, but anytime you're leading with your helmet, you run that possible risk of compressing and actually loading your spine. The fact that Williams' head and neck doesn't really move all that much makes the possibility of a spine injury lower, but still something they have to worry about. We can see it looks like he loses consciousness here, which will play a key factor in what the medical team decides to do. During any sort of trauma or medical emergency, the sequence of steps we go through is ABCDE. No matter what the situation, we always start with the airway, then breathing, then circulation, then disabilities, and then exposures. Disabilities is where the neurologic stuff fits in, but you can see that's fourth on the list. Your airway, your breathing, and your blood flow circulation are the vital things that sustain life, and so those are more important in the initial assessment before we even get on to worrying about what might be going on with the brain or the spinal cord. So when the medical team gets out there onto the field, we can see it looks like Williams has started to regain some level of consciousness. In any athlete who goes down, if they're unconscious, you have to presume they have a spinal cord injury and treat it as such. Also, if they have any level of altered consciousness, meaning they're kind of in and out of it, like it looks like Williams is here, you again have to treat it as if there's a possible spinal cord injury. Even if they have no weakness, no symptoms of loss of sensation, and no neck pain, if they have an altered level of consciousness, you can't be certain, and so you treat it as if there's a spine injury. Let's assume though that the athlete is fully alert, fully conscious, and we need to go through our proper assessment for a potential spine injury. They're initially going to be asking the athlete about any symptoms, whether it's weakness in their arms and legs, numbness or tingling, or any pain. If these are all normal, they're going to go on to a gross screen of motor function and sensation. So asking the athlete to wiggle their fingers, wiggle their toes, and then grossly checking to make sure they have sensation at the ends of their arms and legs. Then we're going to be feeling for any sort of cervical midline pain. So pushing on the back of the player's neck right in the middle, trying to pick up any pain, trying to feel if there's any sort of malformations or kind of bony step-offs, all which could be signs of a spinal cord injury. And then if all these are normal, then we're going to move on to more gentle active range of motion at the neck, and then gradually work on trying to get that athlete back up, only if it's appropriate. Any abnormality during these assessments raises the concern for a spinal cord injury, and we need to protect and immobilize the spine and put them on a spine board and get them to a hospital. Even if Williams just has a little bit of pain when they're pushing on the back of his neck, that's enough to be concerned about his spine and put him on the board and get him to the hospital. And as I said, even if there's just altered consciousness and there was concern for a possible spine injury based on the hit, they're going to presume that there is one, they're going to put him on the spine board and then get him to the hospital. So now they've made the determination that they need to get him immobilized on the spine board and get him off to the hospital. There's different techniques that can be used to get someone from the field onto the spine board, but in general, the safest one with the least amount of motion at the neck is to have a team of people on either side of the athlete, one person who's leading at the head of the athlete, and basically lifting straight up, sliding the spine board underneath them, and then putting them straight back down. The person at the athlete's head, shown in this picture, is who's in charge during this whole situation. This person has control over the cervical spine, and this is the most important position and the person who leads everything they're doing. They're counting whenever they're ready to lift off, they're counting when they're ready to lower the athlete back down, and this whole time you can see this individual has their hands up underneath the neck, providing that stability to the spine. They'll also usually remove the face mask in these situations because it allows better access to the airway in case they need to intubate the patient or put a breathing tube into their throat on the way to the hospital. We typically don't remove the equipment at the field, and most times you'll see the athlete go off in the ambulance with their helmet on and with their pads on. Anytime you're taking equipment off, taking shoulder pads off, it raises the risk of moving the spine more. The official guidelines state that the team may remove protective equipment at the field, but don't specify that you should or that you shouldn't. It pretty much leaves it open to the team that's covering. Sometimes if we're out in a really rural location where we don't know exactly what resources the hospital has, if you've got a really good team of people managing this, sometimes we'll take off the equipment. But far and away the majority of times, athletes are going to the hospital with their equipment on to have it then removed there. Certainly with what happened to Williams here, we've got to be worried about a head injury. I imagine when they get to the hospital, they're going to do a CT scan of his head and make sure he doesn't have any sort of brain injury or bleeding, make sure he doesn't have any fractures anywhere, and continue to monitor his neurologic status in case there's development of symptoms that could indicate a possible spinal cord injury. These are scary situations, not just for athletes and people watching at home, but also for the medical team that's there covering. We understand the potential risk of someone getting paralyzed or having a severe brain injury after these hits, and so that's why we are trained to go through this process. No matter if we're out in the middle of nowhere covering a high school football game on a Friday night, or if it's Thursday night in the NFL between the Packers and the Eagles. The same sequence applies for anybody covering in terms of what we do if there's concern of an athlete down on the field and we're worried about a spinal cord injury or a brain injury. Every situation is going to be a little bit different though, whether you're at an ice hockey rink or a soccer field or covering an NFL football game. Depending on the position that the athlete is in when they're down on the ground, depending on other things like a possible head injury or possible problems with those ABCs, this is something that we get trained on so that we can hopefully be prepared for these different circumstances and keep our athletes as safe as possible. Thanks as always for watching everybody, and I'll see you in the next video.